All right, we're going to start with oxygen safety for CNAs. If you start with the first page where it says eating pizza and picking daisies. I'll start reading here. Oxygen makes up about 1/5 the volume of the Earth's atmosphere and is an essential element of life as we know it. There are a few places on Earth that are said to be without oxygen, like the Dead Sea, and there are organisms that have adapted to live in these places, but humans are not among them. But why do we need oxygen? The answer is energy. The human body has several things it can use to create energy needed to stay alive. Food is one of those things. It helps to make, repair, and replace cells as needed. Another way the body likes energy is from oxygen. When you inhale, oxygen is absorbed into your bloodstream and carried to every cell in the body. It supplies the energy needed to devour pizza, digest it, and dance the night away, to work off all those calories. Oxygen also supplies the energy needed to pump our blood, pick daisies, and give you the power to think, plan, and imagine. Everything you do, every movement you make, and every bodily function, even those you don't have to think about, require oxygen to happen. Unfortunately, some people with lung disease have trouble getting enough oxygen through normal breathing. So they require enough oxygen to maintain energy and normal bodily functions. The oxygen in the air we breathe is safe, but supplemental oxygen comes with many warnings and precautions. So why are there so many safety precautions with supplemental oxygen? Keep reading to learn all about oxygen therapy. All right. Catherine, will you read this first paragraph right here?
Oxygen therapy is treatment that delivers extra oxygen to the body. Oxygen is a normal part of the air that we breathe. Our bodies use it to create the energy to do everyday things like walking, talking, falling, laughing, and laughing. Without oxygen, the body will die in less than 10 minutes. Normally, the lungs absorb oxygen from the air. However, some diseases and conditions can prevent oxygen getting to the lungs and make it shake.
I'll read the next part. When things work normally, each time a person breathes, oxygen enters the mouth or nose. From there, it passes through the pharynx, which forces it into the trachea. Then the oxygen goes through the bronchi into the bronchioles, which spread out like the branches of a tree. From there, millions of small airways carry the oxygen to tiny air sacs called alveoli. These air sacs deliver the oxygen to the blood. In the normal lung, oxygen has no problem getting through to air sacs because our airways are clear and open. Grace, you want to read the next part?
What can go wrong? A common cold, pneumonia, or the flu can cause excess mucus and swelling in the airways that can make breathing a challenge. People with asthma can have swelling and tightening in the bronchi, which keep oxygen from getting to the lungs. COPD causes the airways to become stiff. This makes taking a deep breath difficult. People with heart disease may have trouble pumping oxygen-rich blood to where it's needed in the body.
So next slide. Will you read the compressed oxygen cylinders?
Compressed oxygen for medical use is stored in silver aluminum cylinders with green dome-shaped tops. Large tanks or H-tanks must be secured in a safe corner of a room. Smaller units called E or D tanks are portable and can be pulled along in a car.
Maria?
These devices concentrate oxygen from room air and deliver it to the client. Most oxygen concentrators are not portable. They require electricity to work. There are few models of portable oxygen concentrators, but they are expensive and some very specific requirements. Some very specific requirements must be made for the device to be covered by medicine. Oxygen concentrators are often used for individuals who add an oxygen only at night, but they can also be used 24 hours a day. Clients with this type of device may also have portable e-tank for use during transportation or if there is a power failure.
With most of our patients, we see the oxygen concentrators and then the oxygen cylinders. We're going to skip liquid oxygen systems. That's not something we really work with. And then so on page 4, methods of administration. The method of oxygen delivery is chosen by the doctor. The choice is based on the need for oxygen, the client's mobility, comfort, cost, and the client's ability to cooperate. Delivery methods are classified as being low flow or high flow systems. Most clients will use low flow devices. Jocelyn, will you read the nasal cannula?
Yes. Low flow devices, nasal cannula. This is the simplest low flow method. Most clients find it fairly comfortable and acceptable. It delivers a low continuous flow of oxygen while the client is still able to move around in bed, eat, talk, and even cough without disturbing the device. The client must be alert and cooperative to use this device. If the cannula is removed or dislodged, the oxygen will not be delivered as needed. Simple face mask.
Here, let's let somebody else read that one. You're really happy to read. Oh, we're going to go over here down the back wall. I don't want them to be forgotten. Adrian, will you read simple face mask?
Simple face mask. This is another low flow delivery option that allows a greater
Concentration.
concentration of oxygen to be delivered. A mask will be chosen for a client with a slightly greater need for oxygen. This device is less comfortable than the cannula and must be removed to eat or drink. There is a greater risk for pressure ulcers to develop where the mask touches the skin on the face.
You read non-rebreather mask?
Non-rebreather mask. This mask is required when the client requires a high concentration of oxygen. The oxygen flows into the bag in the mask when the client inhales. A valve prevents the air from flowing back into the bag during the exhale. The mask should fit snuggle and the bag must not be allowed to collapse or completely deflate when the client inhales.
Alrighty. And then, thank you. Do you guys have a lot of trach patients?
No.
How about private duty? How about we go to the venti mask, Junior?
What is it?
The Venturi mask.
The last one.
Venturi mask. This mask can deliver a precise amount of highly concentrated oxygen. It is a cone-shaped device that is lifted to the face. It tends to be uncomfortable and must be removed to eat. The client can talk, but the voice will be muffled.
Ali, will you read the how to keep it clean on page 4?
How to keep it clean on top.
Right, this part.
Oh,
Yeah, because this is good for you guys to know how to clean the nasal cannula.
nasal cannula, okay. The nasal cannula should be wiped with alcohol after each use. If it is used continuously, then a spare should be available to switch out one while the other is being cleaned. If the cannula is visibly soiled or blocked with mucus, clean it out with a soft tissue or cotton swab. If the tubing looks wet inside, switch it out for a dry set and allow it to dry completely before using again. Moisture gives bacteria a place to grow, and you don't want that in your client's lungs. The cannula should be replaced once a week and the tubing should be replaced once a month or just after having a cold. An oxygen mask should be wiped clean every day. Pay particular attention to the areas of the mask that touch the skin.
Jasmine?
What makes oxygen dangerous? If you've worked in a healthcare longer than a minute, you probably already know that oxygen possesses a fire risk. But did you know that oxygen by itself is not flammable? It can ignite and explode on its own. So as oxygen doesn't burn, then what is dangerous? Oxygen is dangerous because it makes other things burn more easily and more intensely. Think about this. Fire is a chemical reaction that needs 3 elements to happen. If you take any of these elements away, the fire cannot start, or it will go out if it already burned or burning. Fuel is a material that is not fire resistant. It can be gasoline, a tree, a piece of furniture, or even an article of clothing. Oxygen. The air we breathe in, is about 21% oxygen. The oxygen level around someone using supplemental oxygen can be much higher. Heat. Heat is the energy necessary to get a fire started. Heat can come from a cigarette, a fireplace, a stove, or even a spark from a static electricity.
Okay. Let's go to the next page. And will you start with the R under rescue?
Rescue, move clients who are in immediate danger away from smoke or flames first. Smoke kills, so bend or crawl under it. Don't breathe it. If there is a lot of smoke, cover your mouth and your client's mouth with a cloth. If your clothes or the client's clothes catch on fire, do the following. Stop right away. Running will increase the fire. Drop to the floor and cover face with hands, and roll around on the floor until the fire is out.
Will you read the alarm?
Pull the fire alarm if you are working in a facility. Report the fire according to the facility's policies and procedures. If you are in a client's home, call 911. When you report the fire, make sure you do the following. Identify yourself, give the location of the fire. If you're in a healthcare facility, give the name of the facility, address, and closest intersection. If you are in a client's home, give the address and closest intersection. Tell the emergency operator the exact location, room number and floor, level, or client's name, room number, bedroom, kitchen, etc. Notify management and the facility or building. If you're in a client's home, notify your supervisor.
Will you read confine, please?
Confine, turn off the oxygen, but only if it's safe to do. So close the doors and windows to slow the spread of the smoke and flames. Don't open doors without checking for heat. If the door is hot, it means there is a fire on the other side. Opening a half door can injure you and cause the fire to spread.
Will you read extinguish, please?
Extinguish fight the fire only if it's a small and container such as waste basket or frying pan, and only if you have been trained to operate a portable fire extinguisher wherever before you begin to fight a small fire. Make sure the area has been cleared, the fire has been reported, and you have a clear exit path for escape.
All right, page 7. Patty, will you read the first and second part under general oxygen safety tips, the first and second one?
Post signs in every room where oxygen is in use. Make sure that absolutely no smoking occurs when oxygen is in use. Secure any non-portable oxygen cylinders tightly and store in a well-ventilated area. Never store oxygen tanks in a closed cabinet or a trunk of a car.
Dolores, can you read the next two?
Oxygen cylinders and vessels must remain upright at all times. Never tip an oxygen cylinder or vessel on its side or try to roll it to a new location. Oxygen concentrators should be plugged into a properly grounded outlet only. Never use an extension cord.
Be familiar with the equipment and the safety checks provided by your employer and the equipment manufacturer. Learn how to turn off oxygen in case of fire. Turn the cylinder valve off when the oxygen is not in use. You want to continue?
Yeah, do another one.
Always turn oxygen cylinder or container valves slowly. Abrupt starting and stopping of oxygen flow may ignite any contaminant that might be in the system.
Thanks. Josephine, can you read the next one?
Liquid oxygen is extremely cold. Touching it can quickly freeze the skin. The vapors from the liquid oxygen are also extremely cold and can damage delicate tissues, such as eyes. To prevent injury from freezing, never allow any unprotected skin to contact prostate parts of liquid oxygen vessels and stand clear of vapors. Keep oxygen tubing liquid cold so the client will not evaporate. Should I continue?
I'll go. Do not place the electrical cord or oxygen tubing under rugs or furniture. Do not use petroleum-based lotions or creams like Vaseline on your client's face or upper chest. Use a water-based product to moisten lips and nasal passages if it is needed. If a skin moisturizer is needed, consider using cocoa butter, aloe vera, or similar products. Avoid bedding and clothes made of wool, nylon, or synthetic fabrics, as the material have the tendency to produce static electricity. The use of cotton material, bedding, and clothes will avoid sparks from static electricity. Do not allow children or untrained individuals to handle or operate oxygen equipment. Never try to repair broken equipment on your own. Notify your supervisor to request replacement equipment right away. In home care settings, make sure smoke detectors are working. Have fresh batteries installed and perform monthly checks. Ensure that you have an all-purpose fire extinguisher close by and familiarize yourself with its use. Help clients and their families prepare an evacuation plan. Draw a rough plan of the home, noting doors and windows that can be used for escape. Make sure doors and windows open easily. Designate one place to meet outside the home. Conduct a drill a couple times each year so everyone is familiar with the routine. Notify the local fire department, gas and electric companies, and telephone companies when home oxygen repair is started. Requesting a priority service listing. This is for those times when there is power or telephone failures or repairs are needed on a utility. Okay, let's see. If you don't mind, I'll just keep reading a little bit. As a nurse assistant, you have a very important job of recognizing and reporting any abnormal observations you make. For clients using oxygen, it's important to watch for and report any signs that the client is not getting enough oxygen or that the client may be experiencing oxygen toxicity. Here's how you'll know. Take and record your client's vital signs before and after he or she uses oxygen. If the client is on continuous oxygen, be sure to check and record vitals at the beginning of your shift and then as needed if you notice any changes. Not enough oxygen? Hypoxemia, which means not enough oxygen, can occur when the lungs are not functioning properly or when the heart is unable to pump enough blood to the lungs for oxygenation. For clients already on oxygen, hypoxemia can occur if the oxygen runs out. There is a kink in the tubing, the cannula is not properly placed, or the prongs of the cannula become blocked by mucus. Symptoms of hypoxia can include shortness of breath, elevated blood pressure, rapid heart rate, lightheadedness, and cyanosis, a bluish color in the skin. Oxygen toxicity, usually oxygen is a good thing, but not in all cases. Remember, most people breathe in oxygen and breathe out carbon dioxide. The carbon dioxide is the waste product that the body must get rid of. For some people with COPD, supplemental oxygen causes the body to hold on to the carbon dioxide, which can cause drowsiness, headaches, and in severe cases, lack of respiration, which may lead to death. In people with chronic obstructive pulmonary disease, carbon dioxide toxicity can be prevented by careful control of the supplemental oxygen. Just enough oxygen is given to maintain an oxygen saturation of 88 to 92%. Preventing pressure ulcers. When caring for a client with oxygen, put elastic headband or ring that secures the face, mask, or cannula in place to see that it is too tight or causing pressure areas. Look for irritation from the mask or cannula around the face and the ears. Pad pressure areas with cotton. Pressure ulcers can result from tubing that rubs on the skin on the top of the ear. Keep the skin clean and dry under the cannula or mask. Have you guys ever seen that before, where it starts to go and break into their skin here and causes a sore?
Yeah.
So definitely keep an eye out for that and help to prevent that. You can just take a 4x4 and roll it up even and put it there, and then it helps a little bit with some of that friction. Hydration is important. Give frequent oral hygiene and adequate fluids to the client. Oxygen dries the tissues, causing the client's mouth to become dry and stale tasting. Keep it clean. Observe the nasal cannula for mucus buildup. Assist the client or family member to clean and replace the tubing as needed. Keep it flowing. Make sure the client is not lying on the tubing and the tubing is not crimped or kinked. This will cut off the flow of oxygen. Position for airflow. If your client is confined to a bed, the best position is to elevate the head of the bed at least 30 degrees. If the client is able to move, encourage frequent position changes. If the client cannot move himself, reposition at least once every 2 hours. Coughing and deep breathing exercises. Have client inhale deeply, hold breath for several seconds, and cough 2 or 3 times with the mouth open while tightening the upper abdominal muscles. This technique can help keep airways clear and strong. Encourage activity as tolerated. Immobility makes breathing problems worse. Body movements help mobilize secretions. Help your client get some form of exercise every day. It can be walking if the client is able, or simply sitting upright and stretching a little. Maybe those patients that are bedbound, having them brush their own hair, moving the arms, extending the arms may help with the breathing. I'm just trying to think outside the box, which really isn't outside the box, but I think maybe, just every little bit of baby else. What are you laughing at? Helps. And then eliminate irritants. In-home care, look for eliminate things that may irritate your client's airways. This may be dust, animal dander, open windows during hot pollen counts, and harsh cleaning chemicals. And let's take the test. Sure.
When they are on oxygen, they cannot be close to a stove. But it's not even the one that is electric.
Well, that it's still puts off heat. I wouldn't chance it. Yeah, I would still keep them away from it. Absolutely. Okay, number 1. The human body uses oxygen to create energy. Our bodies use oxygen to create energy to do everyday things like walking, talking, folding laundry, and laughing. Number 2, oxygen tanks should be stored
Upright and secured.
C, upright and secured. Secure any non-portable oxygen cylinders tightly and store in a well-ventilated area. Never store oxygen tanks in a closed cabinet or on their sides. Number 3, your client is on oxygen and is complaining that her nose and lips are dry and painful, you should
Apply water-based moisturizer in the dry area.
Letter C.
Letter C.
See,
Yep, you're right, C, apply water-based moisturizer. Number 4, fire is a chemical reaction that needs all 3 of these elements to burn except
Carbon dioxide.
carbon dioxide. Carbon dioxide. Oxygen needs fuel, heat, oxygen to burn. If just one of these elements are missing, the fire cannot burn. Number 5, oxygen is flammable, true or false?
True.
False.
False.
Oxygen supports combustion.
Not claimable.
Yeah. Oxygen supports combustion, which means it makes other things burn more easily and more intensely. So it's false. Yes, number 5 is false.
6, true.
Number 6, oxygen
Oxygen
can be harmful to some people with COPD. True. Oxygen can be harmful to some people with COPD. For some people with COPD, supplemental oxygen causes the body to hold onto the carbon dioxide, leading to oxygen toxicity. Number 7, touching liquid oxygen can damage skin. True. Liquid oxygen is extremely cold. Touching it can freeze the skin. Number 8, it is important to restrict or withhold fluids from people with oxygen. False. It is important to give adequate fluids to people with oxygen. Frequent oral hygiene and adequate fluids can prevent a dry and stale tasting mouth. Number 9, if a fire starts, the first thing you should do is grab the fire extinguisher. False. If a fire starts, the first thing you should do is move any clients in immediate danger. Remember, RACE. Rescue, alert, confine, extinguish. And then number 10, if it's safe to smoke while on oxygen as long as you do it outside.
False.
False. It's never safe to smoke with oxygen. Or smoke at all. Make sure you put your name on it, the date, make sure you sign it, and then fill out the questionnaire on the back, please.